Good morning, guys. My name is Avery. Today is April 25th. It is about almost 6:30 a.m. I have about 2.5 hour drive to San Francisco for my pre-op appointment with my microsurgeon. I will be doing updates throughout the day after I see my surgeon, and then during that time, and also today when I have my COVID test. So I'll be updating you guys throughout the day. I'll see you later. Hey guys, I just got to my appointment. I'll let you know how it goes. I'll check in with you when it's over. Hey guys, I just left my appointment with my microsurgeon. His name is Dr. Gabriel Kind. He was very nice. He did answer all of my questions, and he was definitely reassuring. I'm very happy to have him, and I did record the appointment, voice record it, so I will post that in the video as well, so you can listen to my appointment and all the questions that I had. I do have to get a COVID test next. It is not until 2 o'clock. I'm going to try to change that to see if I get one sooner, so I don't have to be in San Francisco for that long. Good, thank you.
Avery.
Yeah.
Okay,
Nice to meet you.
Meet you. Where's home for you?
I just drove from Roseville.
Is that where you grew up?
No, I grew up in like Natomas, Sacramento, so kind of close, but
yeah, not too far.
Yeah.
Okay, are you ready for this?
Yeah. Are you ready?
Oh yeah. All right, let me catch up a little bit.
Yeah, no problem.
So, pretty healthy otherwise, right? You haven't had any other surgery other than your top surgery and your hysterectomy?
Yeah, correct.
And you take some anxiety meds and your testosterone?
Anxiety, I take it off and on, not as frequent as I used to.
Mm-hmm.
So I'm kind of getting over it. So, but yeah, the testosterone, yeah, I take that every week.
Got it. When was these other procedures? What years were that?
The hysterectomy was January 7th of this year. And then for the mastectomy, the first one was June of 2020. And then I had a revision on March 2021.
Who did those?
Dr. Perrett. Brian Perrett.
Oh. Okay. It's too bad we couldn't have got him to help on this. You know,
I thought he was going to, honestly, because he's the one who referred me to Dr. Safer. And he's like, oh yeah, we do them together every week. So I thought he was going to be helping, but oh well.
Yeah, he's pretty busy.
Right.
And we kind of, there's usually if somebody's identified with one of us like that, we get them on.
Right. Yeah.
But I don't know what happened. Sorry about that.
No, it's fine. Yeah, no problem.
Yeah, I think it's me and not him.
Right. Yeah. Yeah.
I forget who it is on Friday, helping me. Yeah, I don't have it in my book here. It doesn't matter. Everybody's good. We've been working together doing this since about 2015, which
okay.
So it starts to add up. There's a couple things. First of all, I'd like to, it's always nice. I appreciate you coming down today. I know you got a lot going on.
Yeah, of course. I prefer to meet in person than over the phone.
Or I've had plenty of these where I walk in on the morning of surgery and it's a little harder to get through all this, and everybody's got other stuff going on.
Right. Yeah.
So we're going to use your forearm.
Yeah.
And we're going to use your left forearm.
Right.
The right forearm.
Yeah, I'm left-handed.
Perfect.
Yeah.
So we'll establish that right off the bat. That's funny. The one I did last week we did it right also.
Yeah.
Yeah. So it happens. It's just we like to have a good reason to do that.
Right.
So we're going to do right forearm phalloplasty. And I've been doing this for a while, obviously, and it's been very impressive to me how informed you guys are as a patient group.
Yeah.
Right? So there's probably not a whole lot that you haven't already learned about, but obviously I'm here and we can talk about some questions. Let me do that test, the Allen's test. You familiar with that?
I heard there was some type of...
Very straightforward. Just turn your seat a little bit more towards me. Perfect. So first thing, we just listen for your, actually feeling for your pulses here. Okay. So go ahead and open and close real wide. Yeah. Make a big fist now. Good. Do that about 5 times. and then hold it open. You got it?
Mm-hmm.
Now relax it a little bit. Good. Now hold it open again. Now close it again. Open. Relax.
You checking the blood flow?
Yeah. Just looking to make sure it's got good blood flow based on this ulnar artery. Let's do that one more time. Open and close. Let's just do 3. 1, 2, yeah. 3 wide. Now relax a little bit. Yep. Hold just like that. Yeah. Nice and pink.
Nice.
So, you're pretty tall,
Mm-hmm.
and you got a pretty good length of forearm. The one thing about the forearms is sometimes people have unrealistic expectations about length.
Yeah.
Shouldn't be a problem for you. Do you have a set goal for length?
When me and Dr. Perret talked about it, he said usually with the forearm you can usually get like 6.5, like at the most.
Right.
And that's cool with me.
Yeah.
I would say like 6 would be like ideal.
Okay. So, there's your 6 inches right there.
Okay, cool.
Now, as the scar gets up onto the palm, it's ideally, in terms of healing, I would prefer to have the scar end about here rather than way up there.
Right, yeah.
So I'll cheat this one a little bit,
Okay.
but we really need this length here.
Right.
And then, so it's ballpark, this long, which is essentially 6 inches. I'll show you again. So you get it. There's your 6 inches.
Cool.
Now, once we do it, and the skin everything shrinks a little bit, but it'll stretch back out to 6 inches for sure. If you get that marks on there. So what'll happen is Friday morning I come in, I see you, and I'm basically just going to take a purple pen and just put a mark on you that we talked.
Yeah.
The other thing that we always talk about today is the glands.
Yeah, I was going to ask you about that.
I beat you to it.
Yeah, you did. To my questions.
Okay. So the way that we make the glands is by lifting up some skin.
Yeah.
And when we make the incision to lift that skin up, we're taking away blood flow from this direction, from coming out.
Mm-hmm.
So it has to have really good blood supply coming the other way. So it really depends on how much, you have a pretty, it feels, some guys have like no fat underneath their skin. It really depends on the blood supply to the soft tissue.
Okay.
So you've seen videos of this, you know how this kind of works?
Yeah.
So we're making a tube, and then we put the tube within the tube.
Yeah. Right. And you wrap the catheter.
Right.
Yeah.
So the catheter's in there.
Yeah.
Here's the tube. But then to make the glands, we have to lift up this flap of skin.
Mm-hmm.
So until we get this thing all wrapped up, and then we look at it. And if it's nice and thick and healthy, I really like to do a glands. They look so much better.
Yeah, I would like that too.
Yeah, they look great. They look totally like a phallus.
Mm-hmm.
They're kind of amazing. But if the blood supply is no good, then what happens is the part of the glands can die.
Okay.
And you can get it fixed later on, but it's kind of a drag. And if there's a question about blood supply, you're way better off waiting a few months and getting it fixed when it's less likely to die.
Yeah, okay.
So I'd say we do glands about 80% of the time.
Okay, cool. Cool.
But it's always the first thing people say when they wake up. I always liked having it, the nurses, everybody's like, ooh, look at that, it looks so real. But,
yeah. It doesn't look like a log.
Right.
Yeah.
Right. So
if for some reason you can't do it this time, is it able to be done when I get like an implant in the same surgery?
Or even before.
Okay. So you wouldn't have to wait like the 9 to 12 months?
No.
Okay.
Can you stand up and let me just take a look at your belly and your groin? You don't have to take your pants all the way down. I just want to see. Yeah. Can you come down just a little bit for me? So you understand how these incisions will work.
Yeah.
So the incision will come, actually in you it'll be on this side.
Okay.
The incision comes right along here. So I hope you don't mind me checking. But
yeah.
I've had some, and I can tell from what you wrote down. But some guys, if their belly's too big, we just can't do it.
Okay.
You're fine.
Okay.
Have a seat. What kind of work you do?
I work for Anthem Blue Cross, customer service representative.
Cool. How'd you get that into that?
I knew people who worked there, so they kind of,
Looped you in.
Yeah.
Excellent. All right.
Yeah, I'm kind of struggling with them right now because they only approved me 6 weeks. Yeah, so we're going to have to do something about that.
Here it is. You wrote it down. Customer service representative, Anthem Blue Cross. All right. So is Kayla, is that your...
That's my girlfriend.
Yeah. Is that somebody you want me to call when we're done?
Yeah, I think she's going to be in the area. We're still trying to figure out if she's able to stay or not. Right. They said they'll call me the day before.
Okay. So the way it works is I see you Friday morning. Again, I think you obviously, you understand the benefit to both of us of you coming in today.
Right.
It's so much nicer just to,
yeah, of course.
Look, you're going to be lying down and whatever.
Right.
So, but I'm going to come in and say hello, real quick hello. Hopefully Kayla's there with you.
Yeah.
Put a little mark on your hand. Anesthesiologist will come in. Dr. Safer will be there. You have to see all of us before we go back to surgery. And then we'll do your surgery. You'll wake up in that recovery room area. They like you to be really awake before you go upstairs, which I think is a good rule.
Okay.
And then you go up to the 4th floor. You'll stay on the 4th floor throughout the weekend. I'll see you every day. The other surgeon might see you one of the days. Doesn't matter. Okay. I'm around. I'm not traveling or anything. And then on Monday, we'll send you down to the 3rd floor. And Tuesday, we get you up into a chair. Wednesday, we get you walking and you leave here.
Nice.
Pretty straightforward.
Okay.
Okay?
Yeah.
So, great. You got any other questions for me?
Yeah, I do. I wrote them down. Okay, and so we already talked about the glandoplasty. And if any of these questions you don't know, I'll just ask Dr. Safer.
Sure.
So for like hair, do any areas need to be like removed or shaved? Like down here or like my arm?
We do it all the day of.
Okay.
Yeah,
okay, cool.
Do that in advance. Okay.
And then as far as like wrapping afterwards, the list Dr. Safer gave me says to use zero form. Is it okay to use Adaptic or do I need zero form?
Adaptic's fine.
Okay. And then as far as my arm, since you're taking like nerves from my arm, will I have less sensation in it afterwards?
That's a really good question. Let me show you. So there's a sensory nerve that comes right through here. And this sensory nerve does the back of the thumb here to about this level here. So it's a really big nerve. It's interesting. It comes out right about here and it comes here and it does this. And it gives little branches up into the skin. Now remember, we're taking this skin with us.
Right.
So what we do is we preserve the big trunk of the nerve that provides all of this, but we have to divide some of the nerves that come to here. So it's very common for people to wake up and say, oh yeah, I'm kind of numb at the base of my thumb, doc. You said, blah, blah, blah. I go, don't worry about it, because I know we preserve that big nerve. Okay. So the rest of the hand should be fine. Okay. There shouldn't be any questions about that. And the groin should be fine too. Okay.
And then is it normal for people to go to like physical therapy afterwards for hands? Because I type a lot, so I want to make sure that I have good like range of motion and everything like that.
It's interesting. So some of that has to do with how your scars are.
Okay.
And obviously, your scars look normal. You're a Caucasian guy with normal looking skin. I can't predict. Some guys tend to be darker skinned guys, but some guys will just make a really firm scar there, and they have to really work out their wrist motion. Okay. But generally, the fingers are fine. Okay. And actually, typing's pretty good therapy. Okay. First one of these I ever did, the guy came back, you'll see me, actually we should talk about that today too. You should have an appointment. Do you have an appointment with me yet, post-op?
Yeah, on the 9th.
The 9th. That's probably perfect.
I think it's a Monday. The Monday after I leave.
Okay. So your surgery's the 29th. you will go home on the 4th. It can't be the 9th because that's a Monday. Yeah, that should work.
Okay.
Yeah. Usually it's later in the week, but I know I'm out of town on Thursday, Friday,
Okay.
12th, 13th. So
Okay.
let's just leave it at the 9th.
Okay.
Okay, so imagine I see you on the 9th. It's essentially, 10 days, almost 2 weeks from your surgery. The guy came in and he was like this with his he got a splint on.
Right,
here.
right, yeah.
And I go, okay, let me see you bend your elbow. And he goes, oh, I didn't know I could bend my elbow. So for holding his elbow still for 2 weeks,
Oh, wow,
he
yeah.
was really stiff.
Yeah.
Now, at your age, you're going to be fine.
Okay.
But what I'm going to tell you, and I'm going to remind you in the hospital, you're going to be holding your hand. It's going to be your right hand.
Yeah, right.
And I'm going to say, hey, don't forget. Because it hurts a little bit to straighten it out, especially in the beginning. But once you get home, I want you to just start working gradually on straightening it out. Because that's it. And then the wrist stuff, we don't really want you moving until I see you and take all the dressings off and make sure the skin graft's okay. Same with the hand.
Okay.
In the morning, I might say to you, hey, wiggle your fingers a little bit, but I don't really want you playing, no keyboard.
Playing the piano, or yeah,
Nothing.
Yeah.
Nothing for, solid week, 10 days, something like that.
Okay.
Then, once the grafts are okay, then we really, then we get you going again.
Okay.
Now, some people, once they get out of all that, if they're a little sore, hand therapy can help.
Okay.
And it's a good idea. But again, at your age, I'm not really that worried about it.
Okay.
But it kind of depends on how stiff you are. I have a very low level of sending you to that because I think it's so helpful.
Okay. Okay, cool. And then we talked about the length. What's the average girth that you get?
The girth totally depends on how thick you are.
Okay.
So,
Yeah, my arm's kind of skinny.
Well, you say that, but there's some stuff here.
Okay.
I think it's going to be good.
Okay. Cool. And then in regards to the phallus post-op, I've watched several videos and different guys have different instructions. Someone said I have to lay down for a month straight. What are your recommendations or restrictions on that?
No, we want you walking.
Okay.
It's the weird part for a lot of guys is just the whole well, where does it go when you walk? There's some special underwear that they give you, and a lot of guys will prop it up a little bit with some a washcloth just to make sure it's not getting too bent or anything. But I've really actually never heard of anybody telling patients to stay in bed for a month. That's bad. I mean, to me that.
Okay. So sitting down is fine.
Yeah.
Okay.
Yeah.
All right. Cool.
All good.
Yeah, I know everyone's different, so I just want to make sure.
Yeah.
Let's see if I have any more questions. And then, do you use Integra?
We do.
You do? Okay.
Yeah.
Okay. I think that's all the questions that I have. I think the rest are for Dr. Safer.
Dr. Lee, one of our microsurgeons, the last time I worked with him, he was trying a different thing instead of Integra, but that's why I hesitated, but that was just something he was trying out.
Okay.
Instead of using Integra.
And you have the wound vac on it and everything? Okay.
So the wound vac just sits on there. We'll get you out of the hospital with the wound vac. And, usually the wound vac comes off the first post-op visit.
Okay.
The leg stuff, we have this special dressing. Did you hear about that?
Where
Where the
all
skin
the
graft
fluid
is
just
taken.
stays in? Is it that one?
No, like a sticky dressing. We
Oh,
don't
the
use
ones
it.
I've seen, it just looks like a kind of like a bag
Piece of cellophane?
type of thing. Yeah, and all the blood just sits in there.
We don't. What we use is this stuff that's made out of it's made out of seashells, and it's kind of got fibers in it, and it just soaks it up, and then it gets hard, like a scab.
Okay.
And I've been a plastic surgeon a long time, and the way we've changed dealing with skin graft donor sites is interesting. But for many years we used Xeroform.
Okay.
We put Xeroform on, and while the patients were in the hospital, we'd have a blow dryer on trying to dry it up.
Oh wow.
Just to make it turn into a scab. But this stuff that we use now does that for us.
Okay.
So we just keep it covered.
Uh-huh.
Before you go home, we might have to, put more dressings on it or something, just if it's leaking around the edges or something. But really, the longer you can keep that on, the better.
Okay.
Because it's just turning into a scab underneath. And then when I see you on the 9th, I'll take everything off on top of that scab, and I'll show you, look, here, the edges will be peeling off like a scab, and it's healthy underneath and all that stuff.
Okay, so I don't have to change really anything.
You're not going to do anything.
Okay, just like
when you're walking, there's an ACE wrap around it.
Okay.
And you may need to reapply the ACE, just because when you walk, the ACE starts to slide down.
Right. Cool. And then as far as the phallus, are we wrapping that at all, or is it just...
We prop it up. You just sit there. If you hang out with it,
Nice.
it'll be covered up.
Cool.
No wrap on there, no.
Nice. Cool. And then, do the drains come out before I leave?
Yeah.
All right, cool.
Get your drains out.
Cool.
Probably not till that Wednesday, but we'll get them out.
Right, okay. I think that's all the questions I have.
If you think of any, here's my email address. It's on my card.
Okay. Cool.
It's
Thank
good
you.
for you to have anyway.
Yeah.
All right. I'll see you Friday. Have a great week.
Yeah, thank you. You too. See you Friday morning.
You bet.
Hey guys, I just got back home from San Francisco. I was able to do my COVID test early, so I did not have to wait in the city for 5 hours and then sit in commuting traffic on the way home, so that was cool. I will be putting all these videos together and we'll be posting it once I'm done. And then tomorrow I'll be doing the pre-op appointment with the urologist at the Crane Center, Dr. Michael Safer. So I will be doing that tomorrow. Thank you guys for watching. Have a good day, and then I'll see you guys tomorrow.